Hello, I'm Dr. Paul Byers, an associate professor in the Department of Preventive Medicine at the University Medical Center and former state epidemiologist for the Mississippi State Department of Health. And I am your host for Physicians Lounge, a podcast from Mississippi State Medical Association. And today I'm joined by Dr. David Byers, who's the Associate Vice Provost for Health Sciences and a professor at Mississippi State University. And today we're going to be talking about how the Mississippi agricultural community is often overlooked and why the rural lifestyle matters. So, Dr. Byers, welcome. And we know that a high number of Mississippians live and work in rural areas. Tell us a little bit about that and what may be the public health need or the health needs of that community.
Right. So, well, thanks first for that. Thanks for having me on. It's a pleasure to be with you and the MSMA members and other listeners who will be joining us for the podcast. So, when we think about the rural population in Mississippi, about 52% of our population live in rural areas, and that's a high percentage. And so that means that a lot of the folks that we're seeing in clinics are from those areas, and we know that a lot of them are underserved and don't have access to health care in the way that folks in more urban areas do. We're compelled to think about what is it that's different about that population. It's not just that they are on the road more or they have a greater distance to access care, but there's some things that are just inherently different about the lifestyle: access to healthy foods, access to recreational resources, access to education can look different in rural areas than in more urban, higher served, well served areas. So lots of just kind of inherent differences in rural and urban populations that we have to take a step back and think what's going on, what's driving these differences that we might see when they show up in our clinics or in our classrooms for teachers or whatever it is. In this case, we're talking about clinical services.
So this is a unique population for sure with unique issues. What what are some of the high levels of trauma or strain or some of the chronic illnesses that our agricultural and rural families may face?
Right. And I think when we're thinking about statistics, one of the things I didn't mention is that 17% of our state's economic impact is from agriculture. So that's the largest of
Right.
any percent, largest of any industry in the state comes from agriculture. So major issue for us to be sure that population is taken care of. When we think about things that affect that population that are often outside of their control, maybe more than folks in most industries, things like government regulations that they have no control over. They're often in large agricultural operations. There's multiple threads of families, generations of families that are tied up, and the further you get down, the more families you might have tied up in an agricultural operation. That can make things challenging. Debt, just the cost to operate a farm is extraordinarily high. On the livestock side, there's illnesses that while they do their best, these producers do their best to prevent those illnesses, they can't always prevent what might drop in. Interest rates, when we do think about debt and when they're taking out loans, the interest rates that are outside of their control are a major source of stress. And then the price that they get for what they're selling, be it row crop products or be it livestock. When we had this conversation in a different setting, Dr. Edney raised his hand and commented, we were watching some films we've done on farm stress, and Dr. Edney raised his hand and said, one of the things that I see as an analog to medicine is that just like physicians, farmers are price takers. They don't get to set their price for the services they offer. So physicians can resonate with that. You don't get to name your price in the way that somebody selling a widget at a store gets to name their price. So lots of stressors outside of their control.
Natural disasters, floods, drought. These are things that can really impact mental well-being and health. And what about access to care living in a rural setting?
It absolutely is an issue, and we see a lot of telehealth emerging, and I think we often think that's going to be a magic bullet, but we we layer on that we don't have great broadband access. If we, if
Right.
folks were even willing to take telehealth as an option, broadband access is limited in rural areas in many cases, and so that further limits what might otherwise be a good solution or a good resolution for that issue. So definitely access to care and access to quality care.
And it sounds like there may be a disconnect or distrust of traditional healthcare training models or delivery of healthcare when it comes to addressing these rural families.
So distrust, I think, is an interesting word. I think it's probably appropriate. Distrust is, maybe part of it. I also wonder, and we've seen in some of the research we've done, the focus groups and the interviews we've done, a sense of pride that farmers have in seeking help. There's a sense of I pull myself up by my own bootstraps. I'm a man's man.
And sometimes that resilience can get in the way.
It can. We need to be willing to let our guard down and seek that help. So I think as providers thinking about how can hey, we talk a lot about social determinants of health, and we know that economic status, but not just economic status, occupation is one of those social determinants of health. So we may be talking about very wealthy people, but still they've got that facade of pride that could get in their way. So thinking social determinants of health, occupation, agriculture, what am I walking into when I walk into that clinic room? How can I help them be willing to step into this moment with me as a provider? And
Have some vulnerability and receive that care. It's tough. So do we risk leaving these families behind, either underserved or are not seen by the healthcare provider?
well, I think that we certainly risk that. I'm optimistic that in Mississippi we've got great public health leaders and physician leaders. We've got great leaders across the healthcare spectrum that are committed to meeting the needs of our rural communities. We we don't have to. We don't. Yeah, we do see. I mentioned broadband a minute ago, and telehealth is a potential solution. I know we're doing a lot to extend broadband into rural areas, and so I do think that increasingly telehealth will be provide us an opportunity to meet some of these needs that we're seeing emerge. But I also know that we've got very compassionate healthcare providers in this state who do want to see us do better and be better and have a healthier population. So yeah, it's a risk, but I think with things like we're doing today, having these conversations, raising awareness, I think we're moving forward.
So what should the provider do? What should the physician be thinking about as we look at this problem?
Well, I think number one is educating yourself on what are the issues that this population faces, and again, listening to things like this podcast where you're just becoming familiar enough to know that when you're going in to see that patient who comes from this background, you've got to put on a little bit different of a lens and different of approach, and not stopping there, really digging deeper and understanding what are the unique healthcare challenges that they're facing, talking more specifically about those mental health challenges, asking them what may be going on, connecting with them around their occupational challenges. They work hard. There's a lot of physical labor involved in agriculture, but then also that mental health piece is
Right.
it's a lot to carry. I think being willing to dive into that is one of the things it's the biggest. Maybe I already mentioned, but that among men, farmers have the fourth highest rate of suicide of any industry in the country. Um, Troubling, really troubling.
Very, very. And so what are some of the other solutions? We've mentioned broadband, we've mentioned education. What about from the patient side? What should those individuals in rural families and agricultural families know or do differently? Or what are some of the tools that they need to be able to access healthcare in a meaningful way?
Yeah, well, I think a couple things come to mind immediately. One is, I mean, back to education, right? So just taking a little bit of a deeper dive into what's available around them, ensuring that they've got that regular contact with a primary care provider as a main point of contact. There's really no substitute for that. That requires scheduling, and I know it's presumptuous of me to say we'll just schedule the appointment, and I don't presume to know that I don't have that lived experience in agriculture to say that they should just do it. So I think working around what is it going to take for me to be able to put that on my calendar and make that appointment available when I schedule it. I think paying attention to their own mental health needs, being vulnerable not just in the clinical setting but also with peers, friends, finding that source of support, whatever it is. It might be in a religious setting, in a church setting, it might be at the coffee shop before dawn, or at the gas station, or around the coffee pot before dawn in your rural community. I don't know what it is, but finding a way to those friends and colleagues and peers that you can let your hair down with is going to do a lot, does a lot. We know from the research, does a lot for the mental well-being of these producers.
So definitely a public health need and certainly a statewide concern. What have we not mentioned today that you feel like is important for us to cover?
Thinking about the policy implications, and I don't know that there's a lot of room for physicians in particular to step into this space, but from that upstream, what's going on at that policy level, we talk about high prices of inputs and the lack of control farmers have around their prices that they set for things that they're selling. Those are their policy implications for that. I think when we think about that policy environment, we, on the medical side and public health side, we've got plenty of things we're advocating for. Also being aware of what is it that our friends that are also working the halls of the legislature in the agriculture world, what are they advocating for, and how do those things dovetail with public health and with healthcare? I know that we've got a great lobby and a great group in the Farm Bureau, Mississippi Farm Bureau Federation. They do a great job at the legislature, and they look out in big ways for our farmers. And I know that they're connected with MSMA on some exciting conversations over time. And I don't know what the current status of things are, but looking at where we can partner with organizations like that is huge. And realizing that, synergy, 2 + 2 = 5. When we get together with groups like that, we can really make a big difference.
Agreed. And certainly it goes back to health in all policy. And we know that strong policy, even if it may not directly look like it benefits health, certainly can. And as you mentioned, this is an important sector of our state, very strong economic sector of our state, and certainly deserves the attention.
Our food supply, we've not really made that direct connection in this conversation that farmers are producing our food, and we've got
Right.
to have healthy farmers to have a healthy food supply. We talk a lot about local foods. I would just make the connection that those small holder farmers aren't often eligible for those USDA insurance programs that help take care of our larger farmers. So there's the policy environment around this is so complex, and just becoming more aware of that and helping us be better neighbors to our farmers, particularly as educated people, members of MSMA, who are often very engaged in policy things, would would do a lot, I think, to be able to just with your patients, with those you're caring for, letting them know that you're in their corner, not just lobbying for your own issues, but also attentive to what's going on in their world. Will, I think, would go a long way in building that rapport with your producers you're treating.
Well, thank you for joining us today for this very important topic. We've been joined by Dr. David Byers at Mississippi State University, and you've been listening to the Physicians Lounge, a podcast from Mississippi State Medical Association. Thank you, Dr. Byers.
Thank you.